Our speaker for this afternoon is Dr. Rehme. He's a practicing biologic dentist for 28 years. Since 1992, his office began changing their style of dentistry and created a more biologic practice, focusing on creating a mercury-free environment, choosing biocompatible materials, and supporting a healthy nutritional lifestyle. Learning to understand how the whole body works is important to the overall health of patients. Their dental health, well-being not only helped his patients, but also helped his life and his staff's life. He's a member of the International Academy of Oral Medicine and Toxicology, the American Academy of Biologic Dentistry, the American College for Advancement in Dentistry, the Environmental Dental Association, the Occidental Institute, the American Institute of Energy Medicine, and he is a certified clinical nutritionist. Please welcome Dr. Rehme.
Thank you very much. I need to read this disclaimer here for the AGD. I do not have any financial interest of products in my talk or with any companies offering grant money for this continuing dental and medical education program. I do, however, have some products that I use in my office that I put together myself. I'm not promoting those or selling those, but for the purpose of this presentation, I just want to show you what I'm using in my office. I'd like to welcome you to St. Louis. I'm a native of St. Louis in here. I hope you're having a good time. Unfortunately, the weather is not as good as it could be, but one thing I've learned in St. Louis is that if you don't like the weather, it probably can change dramatically in a matter of hours. Monday we had 4 inches of snow. Yesterday we had 80-degree weather, sunshine. Today's kind of gloomy, so maybe tomorrow will be nice. But nevertheless, I hope you all have a good time here in St. Louis. So the topic that we're going to be talking about today is called Nutritional Therapy and Lifestyle Assessment for the Biological Dental Office. And really what I want to start out talking to you about today, you've heard this term over and over again, but I want to give you my version of what biologic dentistry means to me and see how it compares to yours. When I first started out in biologic dentistry, I stopped using mercury about 18 years ago. I wasn't a member of the academy yet, but I found out that somehow removing mercury fillings was helping my patients get healthier. Then once I got to be a member of the academy, they proved that with a lot of science. So I knew that I didn't want to use mercury in my practice. Then the next thing came along about root canals. I heard a lecture from Boyd Haley one time, and he said, you know, I don't know if root canals are good or not. We could have a spirited discussion about root canals, and I'm not going to get into that now, but I did over 237 biopsies that I sent to Boyd Haley's office, and they all come back toxic. And I'm thinking, okay, the science is there, so I don't want to use that. I'm not going to do root canals in my practice either. Then I came back to another lecture, and suddenly someone was talking about cavitations. Well, did you know that you could take out a tooth, and at some point in time, that if the bone doesn't regenerate properly, you could end up with this big hole in the bone. We call it a cavitation. This isn't anything new. This was first discovered by G.V. Black, the godfather of modern dentistry, back in early 1915. But there's still some controversy whether cavitations exist or not. I purchased a Cavitat unit years ago, and it's remarkably accurate, and it shows where these cavitation sites can be. So the first three of them here, mercury, root canals, and cavitation. I'm now practicing biologic dentistry, right? Well, then I went to, and I have the opportunity to introduce a guest speaker this afternoon, Dr. Simon Yu. I met Simon about 15 years ago, I guess now, Simon. And I walked out of his office with this piece of paper that you have on the front of your handouts. Or the handouts are right here if you don't have them, because I've got some Jan, should we hand those out if we can? Or anyway, the tooth organ chart was a remarkable discovery to me about how the whole body was connected. And when I left Dr. Yu's office, he was saying, you know, that those teeth are connected to the big toe. I mean, everything relates, and I was never taught that in dental school. So that's where we started this holistic connection between the oral cavity and the rest of the body. So when you put all this together, now I consider myself a biologic dentist, right? There was one more thing I thought that was missing to this puzzle, and it has to do with nutrition. And I came across this information here about the connection between periodontitis and malnutrition. And what I found was that about 70-75% of the adult population has periodontal problems. Well, I also found out that about 80% of the population is malnourished. Not underfed, but malnourished. So my concern, or my thoughts were, is if we could improve this, would it help to improve the periodontal conditions in our patients? And overwhelmingly, I found out that the answer was yes. I want to read these next two slides verbatim for you because I think it's really important. This kind of sets the tone for the talk that I'll give to you this afternoon, and it kind of helped change the way I practice in my own office. The only place you can see your skeleton is when you smile or open your mouth. Your mouth is the easiest place to see what is happening not only in your teeth and gums but to your health in general. The junction formed by your teeth and the biological seal around them is very sensitive to blood sugar, hormonal, immune, and stress changes, to name a few. This gummy junction serves as a good monitor of inflammatory reaction in connective tissue, breakdown both in the mouth and elsewhere. And this is how I got involved in the nutritional therapy part of it. If your diet deviates 10% from your biologic norm, it may show up first as dental disease, inflamed gums, or dental decay. And this is what I think we all were taught in dental school. But then it says if it deviates more, you may get arthritis even more, you may suffer heart attack, and even get cancer. These diseases often indicate a lifestyle and diet which is not healthy and for which the whole body is no longer able to compensate. And I'd like to give credit to Dan Rosen, who was a member of the Academy, who's no longer with us. But when I met him about 12, 13 years ago, and he introduced this whole concept about, what about nutrition, what about diet, and it really changed the whole way that I was thinking about practicing. I think as a biologic dentist, we're doing more than what I call just drill, fill, and bill. We have a really unique opportunity to help patients like we never thought of before. So the mantra that I use in my office kind of is healthy teeth or healthy mouth. Correlates to healthy body, correlates to a healthy life. Now, within reason, I think this is a pretty accurate statement that we can all use. So what I want to try to do is point out, how do you promote a nutritional program? I'm sure how many people use nutrition in their office? Most people, probably? Okay. So I'm really not going to probably introduce anything new, but maybe you might help to jumpstart your patients and get them on board and how they can use this nutritional information to help them become healthier. First of all, what we need to do is increase awareness, not only for the dental team, but also the patients. And I think sometimes in my practice, we get so busy with the dental revisions and the dental work that we even though we see the periodontal situations going on, maybe we don't make the connection of what we can do to our patients and offer them that supportive help. We also need to learn how to motivate our patients. We're going to go over this too, and they need to own their health. Once they own their health, you can make them do just about anything. And then we're also going to talk about how to create healthy solutions. Okay, so if we just look, can we turn this down just a little bit? The lights at all, maybe? No. Can we turn the lights down a little bit, or can you all see these? Because anyway, we're just going to start out with healthy dentitions, and you know what healthy periodontium looks like: light pink color, no bleeding, no periodontal pockets or anything like that. We still got healthy gums here. Pardon me? We're okay, Jim. Oh, good. Okay. Sometimes you can't see these. So we're going to go from here to healthy gums, and all of a sudden we start seeing these little, thank you, Sharon. We start seeing these little traces, little inflammation here, a little recession, inflammation. We see some plaque buildup. And sometimes, our hygienists will see this most of the time because they're doing the cleanings, usually the prophylaxis, but, are you bringing this to their attention, that when we see these problems, let's dig a little deeper. So we'll just go through a series. We've got some problems going on here. We may get some ANUG. Also, we may see some tooth mobility occur. Okay, so we see this debilitating effect. And you probably don't see these kind of patients showing up every day. This is a great picture to show right after lunch, isn't it? You don't see this every day, but you're trying to get the concept of what is going on in these people's mouths. Okay? We're going to get some tooth loss there. We're getting worse. Don't worry. A couple more. All right. We got problems there. Definite problems there. And this is your first patient that you're going to see on Monday morning. But the point is what exactly is causing these problems? Is it a local event? Is it just a bacterial infection? Do you suddenly wake up and you've got plaque and calculus and bacteria that is growing out of control? Or is there a systemic event going on? And I believe that what we're seeing is an imbalance in body chemistry caused by the inflammatory responses. So this is where I'm going to put my money. This is what we're going to be talking about. You can have genetic predispositions. My mom had dentures, my uncle had dentures, my grandfather, so therefore I will probably lose my teeth and have dentures. Or you can also look at lifestyle patterns. We can look at the nutritional habits. We can look at the hydration, the environment. These are the things that we can control. You know, if we can control these things, maybe the genetic potential won't be quite as effective. But if we can kind of keep these in balance, I think we're going to be ahead of ourselves in helping our patients. I like these next couple of slides are kind of also kind of key in on what we're talking about. Recent discoveries in periodontal research are now recognizing periodontal destruction as an inflammatory response of the host rather than due to just bacterial infection. While bacteria are always present, they may not necessarily be the cause of the breakdown. Infectious diseases do exist, but most degenerative lifestyle diseases like periodontal disease and tooth decay are inflammatory, not infectious. This inflammatory process is known as oxidative stress. Dr. Haley went over that a little bit this morning too. He says this is due to an imbalance or an excessive amount of free radicals. Essentially, with uncontrolled oxidation, we accelerate the rusting or aging, diseasing process unless we have adequate antioxidant defenses. And dietary or outside sources of antioxidants from fruits and vegetables are sometimes necessary to cope with these excesses. And this is what also Sam Queen came up with some information. I really like this slide too because it's kind of in a cascading effect of what's going on in our bodies. He talks about this, the conditions are common to all oral health diseases and may even be a predictor to chronic diseases that may affect any part of the body. So unfortunately, our culture today is really beset with this whole acidemic condition. We've just loaded ourselves with a lot of acid foods that we eat, even some of the drinks that we have too. And what happens is as we continue this acidemic condition, it leads to an anaerobic metabolism, reduced oxygen levels. We see these chronic fatigue effects. It leads to free calcium excess, which leads to chronic inflammation, connective tissue breakdown, and then all this is due to the oxidative stress. And what we're basically doing here is the immune system continues to break down, and the body is just simply out of balance. This is a body that's out of balance. This is a car. I mean, this is what, you know, how could this happen to me? And the same things happen in the car, I mean, due to neglect. But as I tell my patients, it's never too late. You could be 15 years old, you could be 80 years old. It's never too late to change the cycle here and change some lifestyle patterns so that you can correct the situation. So we talk about what's this connection between the tooth and body. This is some work done by Melvin Page, if you remember Melvin Page back in 1949. So this good information back in the 40s. And he was saying that the disease is not due to the presence of bacteria, but rather to the body being out of balance in such a way that bacteria responsible for inflammation is breeding out of control. Killing the bacteria is not the answer, but placing the body back in balance is a much more effective method of treatment. So if we realize this, now all we got to do is just figure out how we can get our patients on board and understand this process. I've given you these handouts. I'm really big on handouts. I like to make sure that, you know, you can listen to this and you can walk away and say, yeah, that was interesting. But it's hard to remember all this. When you get handouts, when you got things that you can give to your patients, those are some articles that I've written in the past. Maybe you can revamp them and make it applicable for you. But I like giving people information that they can take home because it's much more effective than they'll remember it. Not only are we looking at the gum tissue, but we're also looking at the tongue. I don't expect anybody here to be a tongue diagnosis specialist, but I can tell you this is a healthy tongue right here. Okay, you see the light pink tissue. There's no undulation of the tongue. There's a little moisture there. If you remember from Eastern medicine, they've actually, acupuncture, they've mapped out the section of the tongue so you can tell in certain areas, like down the front here, if you see a red tip tongue, usually maybe you're dealing with the heart issues or lung. In the middle, it's the spleen and the stomach. On the outsides here, it's liver, gallbladder. In the back, it's intestine, kidney, and bladder. So as you look at these tongues, you know, again, you might be in a hurry, but if you can take your time and see this is a healthy tongue, and that's a pretty healthy tongue. But then all of a sudden you start seeing things like this. And you start seeing this red tip, you start seeing the undulation, or actually the teeth marks in the side of the tongue. You see a white tongue. Now you know that just doesn't look right, right? I mean, something's going on. How about that? That's a black tongue. That is not right. And that's just not from smoking. Okay, so you're not going to go past it. Hopefully you're going to look at this and then you make this connection. Something else must be going on. Okay? Now here you see the little teeth marks around here. And so with tongue diagnosis, just if you look at the slide there, you talk about if you see a yellow or yellowish green tongue, it could be a liver or gallbladder problem. If you see a gray or brownish gray tongue, usually it could be a stomach or intestinal issue. White is usually an indication that their body is releasing toxins, dehydrator, candida from overexposure to antibiotics. The border, a border with edges which showing the teeth outline, usually a mineral deficiency, and the undulation of the cracks like a dried creek bed or something in the tongue is usually a vitamin deficiency. So again, these are just obvious things that you can see in a patient in just a matter of just a few seconds that you might say, okay, and my point is too that we're not physicians, we're dentists, or most of us here that are dentists, but I think we have this obligation to say we see something that's wrong, let's make sure that we bring it to their attention and get them to the right appropriate specialist that can help them. I also like this slide too because I think this also kind of culminates the whole theme. We're talking about body chemistry. Okay, I think when we're talking about health, we have balance, whether it's physical, mental, spiritually, emotionally, but there's a balance in the system. When we have disease conditions, we have an imbalance going on. And if you're going to stay healthy, there's just two basic metabolic functions that are going on. The cell must receive nourishment, and it must learn, and it must be able to eliminate the waste products. And when we have a deficiency in these, this is when we start creating disease conditions. And at that time is when you're going to see the opportunistic microforms like the bacteria, the virus, the yeast, mold stuff. They're just going to have a party here and they're going to flourish because there's an imbalance going on. I want to show you two case studies that are kind of interesting to kind of prove the point about body chemistry. This is a patient of mine, Jack. He was 48 years old, white male. His initial dental history was chronic advanced periodontal condition, recurrent decay. We did not take his pH at that time, and we're going to go over that in a minute too. But his health status, he had the standard American diet, mildly overweight, high blood pressure, no exercise. And then I didn't see him for 5 years. And what I found out that during that time he had a heart attack. And his postoperative prognosis, his doctor probably gave him the best advice ever. He says, you need a lifestyle change or else you're probably not going to be here very long. So, after his heart attack, his health status had changed dramatically. He started eating regularly, balanced diet, fruits, vegetables, saturated fruits. He was doing all the right things. He was drinking more water. He was exercising. He lost 30 pounds. He had more energy. When he came back to our office for a dental history checkup, he suddenly now had healthy gums. Periodontal pockets were reduced significantly. There was no more recurrent decay going on, and his pH was 7.0. 7.0 being neutral. And again, we'll talk about it in just a little bit, but this is the pH that I want my patients to be at if I consider this to be a healthy evaluation of the oral cavity. Now, 10 years even after that, he was still continuing his health progress, and we saw that it was holding stable. The periodontal condition was stable. There was no more dental decay. His pH was 6.5 to 7.0. General health was still good. And down at the bottom, if you can read that there, what changed? The body chemistry completely changed. This guy was a health freak now. I mean, after the heart attack, hopefully you don't have to have a truck hit you to finally wake up and smell the roses and say it was time to make some changes. And this is what he did. So it was very interesting to see that to this day he's a much, much healthier person. Now, we're going to take a look at Marcella. She's 61 years old, white female, and unfortunately she's on the opposite end of the scale here. When we first saw her initially, her dental history, chronic moderate periodontal condition, recurrent decay, regular checkup visits, her pH was 5.5. Okay, and I'm going to tell you right now, 5.5 is acidic, too acidic. For the next 8 years, anything that we did in her mouth, the dental condition continued to deteriorate. We put a filling in, we put a crown in. She'd come back in 6 months, a year later, the crown was decayed, the filling was falling out. So you kind of start taking this a little bit personally and think, man, what am I doing wrong here? This is, I need to do better dentistry. It wasn't my dentistry. The environment was so acidic, you just couldn't keep it clean. And I will tell you that if you're not, I would strongly encourage you to do this pH check for your patients. We always do it with our patients when they come in for hygiene. They know not to eat or drink anything for 2 hours before they come in, so we can get a pretty accurate assessment of their pH. But if you chronically see these patients coming in below 6.0, years ago there was about 10 patients that I had, 10 patients, ranging from 45 to 73, 74. And it just was kind of curious. These people came in and they were all chronically acidic, and their pH was below 6.0. Okay? Now I tell you, these are 10 patients. The most serious one, she was like 45 years old. She was a diabetic. She always came in, it was like 5.0. I mean, this is just incredibly acidic. All 10 of those patients are dead. Now, the point is, too, and I think as Dr. Boyd was talking about earlier, this oxidative stress that's going on. Your body is accelerating at a tremendous rate. It's just aging too quickly, waiting for another degenerative disease to pop up. But as I say, it was just really amazing. I don't know about you, but 70, 75 years old, I don't think you're ready to check out. Life's just beginning. As you get older, you're supposed to slow down. You're not supposed to feel good. I just don't buy that. Don't buy into that. But I believe that if we can help these patients and tell them that they're too acidic, get them to a physician, help them out that they got to change this chemistry. But anyway, with her health status, you can see she had arthritis, heart disease, kidney failures, respiratory conditions. She had 4 or 5 doctors. She had a list of medications, yay long. As you know, that most medications are acidic as well, so she had a problem there as well. I saw her, she had a STAD diet, no exercise. She wasn't doing anything right. But 9 years after her initial exam, she came into my office with the dental condition was still unstable, general health deteriorating, her pH was still about 5.5. And she came in with a cat scratch on her leg. And the problem was that the body just couldn't fight this infection. The organ system shut down. 2 months later, she was dead. So what didn't change here? Body chemistry never changed. She continued to be acidic, and as I said, the whole body just deteriorated, and her immune system was shutting down, and she just couldn't fight any infections. So you've always heard this phrase here: let's think outside the box. And I really believe that as biologic dentists, if that's what you call yourself, biologic dentistry has to make this connection. And as dentists, we can apply this holistic care. We can support them with nutrition. I think this tooth organ chart, everybody's seen the tooth organ chart, right? You've all seen that, right? And that's a wonderful thing to look and give this to your patients, especially when I started doing extractions, the root canal extractions. And you've seen that too. If you've taken out a root canal, how does the back problem suddenly improve? All of a sudden the digestive system improves. I mean, it's just amazing. So the tooth organ chart, if you can embrace that, I think it's wonderful for your patients. But also the important thing too is our healthcare providers that we work with hand in hand. They need to understand too. I think Alex was talking about, we can't, you don't ask about the doctors to think about above the neck because they weren't trained to look in the mouth. What's going on in the oral cavity? But there's a handout that I've got for you there too. It's a 2-minute dental evaluation. You don't have to be a dentist to look at a mouth and see periodontal inflammation, seeing the tongue, the black or white tongue. You ask patients, how many mercury fillings do you have? Do you have any root canals? But it's just trying to incorporate this concept of the whole body connection. And I think that the medical profession will hopefully connect with dentistry, and we can provide this type of service and interaction between the two. So bottom line here is if we can observe these conditions and refer to the appropriate healthcare providers, we're going to be helping our patients tremendously. And I like this slide too. It says, excuse me here, and I like to kind of believe that we're all maybe in the same boat here, that'd like to be that yellow lamb. Sometimes it's difficult going the opposite direction, but I truly believe I couldn't practice dentistry the way I did 20 years ago. I don't know about you, but I think we're doing it for the right reason. We're helping our patients. So while everybody's kind of going to the left, let's keep going to the right. Here. Oh. So this is my version of conventional therapy for periodontal treatment. If you have a gum issue, you go to a specialist, they're going to review your home care techniques. You need to brush better, floss better. And we maybe do some root plane and scaling. We may do some periodontal surgery. We're also going to treat that with some chemical irrigation. Of course, we got to throw some antibiotics in there. And we're going to see you for regular checkups probably every 3 to 6 months for the rest of your life. Mrs. Smith comes in, the doctor looks at her gum condition, and they're still bleeding. She's had periodontal surgery, and the doctor says, well, you need to do better. Well, doc, I'm flossing. I'm doing everything you say. How come I'm still not getting the results? I think this is why we're talking about we're treating the local effect here. We have to look at the systemic condition in order to help Mrs. Smith and her gums so she's not coming back every 3 months. And this is one of my favorite slides for me to show periodontists. If I can read this, it says, the future of treatment for chronic periodontitis in adults looks brighter than ever thanks to the arsenal of antibacterial weapons. Our whole concept about antibiotics is kill. We're going to kill it all. So if we're going to give you antibiotics, if you've got a periodontal problem, we can fix it. We're just going to kill all the bugs, right? And we know that the more antibiotics you take, you're not only killing the bad bugs, you're killing the good bugs too. So we have Periostat. You're probably all familiar with Periostat. The problem I have with this form of treatment is they're talking about you're taking this after you've done the periodontal treatment like scaling and root planing. You're given this drug for 3 months and even up to 9 months of continuous therapy. And patients who completed 9 months of treatment were observed to maintain the clinical benefits of Periostat, and even for 3 months after the cessation of treatment. Okay, so 3 months, right? That's pretty good, right? We got them after 3 months. Well, you know, obviously the question is, what happened after 12 months? What happened after 2 years? I'm going to tell you, if you're treating the local event, you're treating just the bacteria itself, what's changed? Nothing's changed. It's going to come back. So, you know, it is a low dose, but it's 20 milligrams twice daily. And they talk about, you know, you have side effects of common colds, headaches, diarrhea symptoms. Well, that's okay. I mean, that doesn't bother me. If you're doing that for 9 months, I just think that's negligent, and I think there's a better way to do it. So is there an alternative? Of course there is. Okay, this is my version of the biological therapy. I call this the acute phase. Of course, we still got to remove the bacteria. We still got to remove the tartar. We've got to teach them better home care techniques, probably. But then after that, we're going to try to alter the pathogenicity of the flora. This is what I call the chronic phase. And I don't know if Bernie is here today, but I mean, I've been using this stuff. Everybody, you use this tooth and gum tonic? Oh my God, I love it. I also use the irrigation, under the gum. I also use the toothpaste. And I probably started getting a case of this once a month. I think we go through about 5 or 6 cases a month. I mean, people come in and I think it's an acquired taste, but the reason I really like this is because it is natural. It contains the essential oils and herbs. It's very antimicrobial, but it's different than taking something like Scope or Listerine, which has the alcohol in it. You get anywhere from 16 to 23% alcohol, and when you get that swishing, clean feeling, that's just the alcohol, and it vibrates in about 15, 20 minutes. So this stays longer, and it penetrates longer under the gums. And of course, the last thing about biological therapy for your gums is evaluate the diet. You definitely need to have some lifestyle changes. I also think that supplements are helpful. I don't think it's the end-all and be-all, but I do believe that supplements get you going in a direction. It helps to jumpstart the body, and it'll help to stimulate your immune system. I also like vitamin C therapy. I think it's very positive and effective in the oral cavity. I don't see a whole lot of vitamin C deficiency, but if you do, you'll see these gums and dental problems. It's very persistent. Vitamin C is vital for the production of collagen, so it's a basic framework for all tissue. It's also more resistant to penetration by bacteria. So what we do is we ask them to get a water pick. You fill the bowl up about halfway, and you put about a half a tablespoon of sodium ascorbate in there, and you just go around the gums and just infiltrate that. Does anybody use that in their office? It's really good. I mean, I love it, and you will see changes. I mean, I've seen tooth mobility decrease, class 3 mobility, and suddenly they come back in about 30 to 60 days. And if they're really being faithful to this, you'll be amazed at how much healthier the gum tissue is and the mobility is gone. So I highly recommend that. So now we've got down to the awareness. We're trying to increase awareness, motivation. How do you get your patients to participate in a nutritional program? One of the things that we have is a phase contrast microscope. I highly recommend this for your hygienist to use when your patients come in for a cleaning. We usually do it once a year, unless they request it more frequently. Bill Landers, I don't think is here, but he's been really helpful with me in my office with this equipment. If you have any questions, I'm sure the ladies can help you. But he is still around, and he's doing some great work with this equipment. And the reason I like using it, the advantage is basically it's chair side. You can do it right there. It takes about 2 minutes to do, and you can identify all type of morphotypes. What happened there? Okay, so we get spirochetes, white blood cells, protozoans. It's very well, on the bottom of that, it says it's a good patient motivator. When you can put a live screen sample on your slide and put it underneath that scope and put it on the screen there, and the patients look at it, I mean, you get their attention. You really do. I said, well, some people, oh, that's me. And, yeah, but that's you. So we want to make sure that if we've got some problems, bring it to their attention, and that will get them jump-started. This is a great motivator right here. You all know that. Just grab the mirror and show it to them. You know, you put it up to them and say, here, look at this. This is bleeding. You've heard that, you know, people would be concerned if you would wash your hands and your hands start bleeding. Why wouldn't people be more as concerned about their gums bleeding? Okay, but grab the mirror. They'll be surprised there. And then we get to the pH paper. Does most people using the pH paper in their office? I hope. Yeah. If you're not, I mean, you can get a hold of this. Call me in my office. I'll be happy to get it for you. These are I sell them for about $8 a pop, and they'll last your patients for probably 2 or 3 months. Okay. I always tell patients if they want to check their own pH, the best time is in the morning before they've eaten, drank anything, put any makeup on or something like that, and check the pH. But as you know, right in here, when I first started doing this, I was accepting 7.0 being neutral. Blood pH is about 7.25, 7.3. The saliva, usually I will see, and predominantly most of my patients are 7.0. They are. Did you find it? I mean, most people are pretty healthy. It's just really when you see that 6.5, then I go back in the chart, I say, how long has that been going on? You know, it's been going on for several years. We got a problem. I do not accept 6.5 as being healthy anymore. It's got to be above 6.5. It's got to be somewhere between 7.0 and 7.5. When you get down, these are those patients I was talking about too. That's 10 patients that I just kind of monitored when they were 5.0. I mean, I rarely see that. Has anybody ever seen that with their paper? They check that out? They'll check them and tell them to get to the hospital or something because they're not going to be around much longer. I'm telling you, it's just amazing, but that is really critical. So do your patients a favor if you see that. And I think this, again, it's a good motivator. Unfortunately, we see a lot of patients. Let's see. There we go. And we talk about the diet here. Unfortunately, this comparison of food that the foods that are eaten per person per each year, we look at this. We've got about 2,100 pounds of acid-forming food. Way, way, way too much. And we only have about 380 pounds of alkaline food. So the ratio is should be about 6 to 1, which is way out of control here. And again, my whole point here is this: the body chemistry is out of control. So what leads to this acidemia effect, okay? Usually with the nutritional aspect, we're talking about too many processed foods, eating red meats, white flours, refined sugars, coffee, soda. If I can get anybody to stop drinking soda today, and you don't have to raise your hand, but I will tell you, if you're drinking soda, we go back to the pH scale, right? Soda is about 50,000 times more acidic than your extracellular fluid in your body, okay? And it takes 32 8-ounce glasses of water to neutralize 1 8-ounce glass of soda. That's how acidic that stuff is, you know. And I had a patient one time that came in. She was about 25 years old, and very hyper. She came into the office and kind of just couldn't even settle her down. I looked in her mouth, and she had a lot of recurrent decay around the gingiva, a lot of class 5 cavities. And I said, you know, what's going on here? She said, well, I said, you know, what's your diet like? And it wasn't very healthy. I said, you know, you drink a lot of water? She goes, water? She goes, well, no, I don't drink water. I drink soda. You know, that's fluid, right? I said, no, not really. I said, well, how much are you drinking? Well, she was drinking 12 Mountain Dews a day, and her husband was drinking the other 12. So a case of Mountain Dew a day. I mean, that's probably more expensive than smoking to have it. I don't know. But so I told her, I put a little X in my chart, and I wrote a little line there. I said, okay, I'll tell you what. I will help you, but you got to learn how to cut down on your sodas. Now, again, you can't go cold turkey with anything, I don't think. So if you're going to try to reduce anything, you cut it in half for a month, and then the next month you cut that in half. So in about 3 to 4 months, you can actually reduce, you know, an addiction, I think. But she didn't sign her name, and I never saw her again, so she didn't like my suggestion. Also leading to an acidemic condition, stress. Stress is a big acid producer. We all live with a lot of stress in our lives, but if you can get that under control, we're going to talk about a few things here in just a minute about stress, but that really helps to help limit the acid effects there. We don't get enough exercise, and sometimes we get exposed to environmental toxins. All these things can lead to this acidemic condition. The reason I got interested in it as a dentist, you know, look at all these symptoms for the excess acid waste. You know, you see the fatigue and muscle stiffness, but down here, periodontal disease, dental decay, halitosis. I mean, those are things that we'll see all the time, and that's why I think we have a responsibility to be aware of these conditions. So what's behind the symptoms? Basically, it's junk food. This bioaccumulation effect, as this continues to build up in our system, we start overworking the stomach, the intestines, the livers, kidneys, all the major organ systems, and again, we just have a severe strain on the immune system. And I like this too, is one of the things that I like in my practice, and I think that you'll agree with the patients that you see in your biologic practice, if you will, people are there because they want to be healthy. Have you noticed that? I mean, they say, you know, I think I want to get these mercury fillings out. And I myself, I do not promote the removal of mercury. I don't promote the removal of root canals. But that's all I do in my practice because I make it their decision. They have to own their health. And if that's what they want to do, they sign a consent form. I give Dr. Rehme, if you don't have consent forms, please get some or call my office. I mean, you need consent forms. You probably all have them. But protect yourself so that they give you permission to do what you want to have done. And this is what I was saying, that most of the health of the American people will be determined by what the individual is willing to do for themselves. And rather than that patient that comes in and has double insurance and they really don't care about their health as long as they get it paid for from somebody else, third party, they're okay, you can do whatever you want to them. We don't have that in our office. We are a fee-for-service office and it's worked very well. People are willing to pay for their health. And it's, as long as they get results. So I think that it's just a much more enjoyable atmosphere for me to be working with patients like that. Okay, so the last thing we're talking about is how to create healthy solutions. You've got to educate them. Most of all, you've got to keep it simple. If you make it too complicated, you're going to lose people. You've got to have a plan. And then when you're all done with that, if you want to evaluate how you've done, just look in their mouth again and see if it's improved. What time do I have till? What? 2:15. Holy crumbly. Okay, good. 2:15. Okay. So what I did in my office is I put this together. I have some samples of this if you want to see it. It's called 90 Days to Better Health, and it's really a lifestyle assessment that we do with our patients. I got to move a little bit. And what we do is we talk about nutrition and dietary support. We talk about hydration, exercise, stress management, sleeping patterns, and supplements. So this is kind of like a self-help program. It can help to evaluate. We keep track by week to week and how they're doing in each one of these categories, and it works pretty well. So treatment that we're talking about, if they have the acidemic effects, we want to diminish the amount of acids in the body. Alkaline foods are better. We do have I have a handout there on the alkaline and acidic food charts. That works really good. That's a great handout too. Dr. Yu, I want to thank you for telling me too one time. He says if I had one supplement to give my patient, it would be a digestive enzyme. If you don't get your proteins, fats, and carbohydrates starting to break down, how are you going to absorb them, and how is the body going to be able to utilize? So digestive enzyme is very important. Deep breathing, and also how to deal with stress. I got you the chart there. We also have a homeopathic remedy called Natrum phosphoricum, and it's a really good temporary fix for chronic solutions. You put 6 pellets in the morning, 6 in the evening, and they dissolve immediately. It just helps to kind of introduce a more alkaline environment. If you are really sick, I suggest that when you talk about a detoxification diet, for general purposes, or for if you're really sick, the therapeutic purposes, you really got to bump this up to about 80 to 90% alkaline foods to promote a more healthy environment. General health, around 60%, and this is still much better than the average population. Which diet to choose? Just real quickly, I can't tell you which diet. All of our metabolic our bodies, our metabolisms are all different. Some of them suggest more protein, some of them suggest a little bit more carbohydrates. But my point is here, this is a Okinawa program. I wanted to see the highest longevity of any culture. And really what they were doing is they were just eating fruits, vegetables, whole grains, fish. They had a very healthy dentition and very little periodontal disease. I like the Mediterranean diet. It's probably one of the most balanced diets that I've seen. I'm sorry, I'm going to move a little quickly here. But basically, you know, this is nothing new, but this is what we need to teach our patients. We got to get back to basics. We need to eat primarily natural, fresh, whole foods. Stay away from the, if it has a label, lifestyle. And sugar, we certainly have an addiction to sugar in this country. It is an acid producer. Its local influence will be demineralization of the tooth, and we see that. We've taught this in dental school. But this is, again, what I'm trying to point out here is the systemic influence. We'll create an anaerobic condition. The inflammatory condition persists. When you see periodontitis, think of it as an inflammatory condition. We need to drink more water. Take your weight divided by 2. That's about the number of ounces of water you should be drinking on a daily basis. I use a homeopathic product called Hydrate 2. We got a handout on that. It just helps to increase the cellular permeability. You've got to get water. You've got to get the aqueous solution into the cell, or we're going to have problems with that. And you know you've got to exercise, right? And you know, sometimes just in exercising we get overzealous with, you know, we got to go out there and run 5 miles a day. Even just walking for a mile, it takes 20 minutes. Do it on a daily. If you can work out 3 to 4 times a day, you're way ahead of the game. And sleeping, you need about 6 to 7 hours of sleep. I'm going all through these because this is what I have in this book. You know, it goes through each one of these things. You've got to have about 6 to 8 hours of sleep. If you think you can function on 8 to 5, you're just kidding yourself. You need to recharge the battery. Stress management, as we said, is a very acid producer. Things like exercise, massages, spas. There's some supplements, valerian we use. Ginkgo extracts, those are helpful for supplements. Going on vacation, that'll help reduce the stress most of the time, right? These are the products that I use in my office. We made these specially. This is our the Bio Ultra Pack that has in it the basic supplements. And I think, and again, I'm not practicing medicine. All I'm trying to do is help my patients just think about being healthier. Get off the couch, get active, and try to stimulate this body and get it going in the right direction. Excuse me. So we have 2 packs. And I've also learned something too, is the more bottles that you open, the less compliance you get with your patients. We have 2 packs that you can open up. There's an AM pack and there's a PM pack. But we just have a simple multi-mineral vitamin. We have a digestive enzyme, an amino acid, essential fatty acid, omega-3s, antioxidant, probiotic, and a CoQ10. Sounds like a lot, but it's really not. Supplements, basically here we're concerned about the detoxification. We use the bentonite clay to help absorb the toxins and eliminate those. Cleansing, we use the psyllium powder, which is designed, you know, it's an indigestible dietary fiber that kind of expands when it's exposed to moisture, and it kind of helps to clean out the colon. So again, I was talking about your success story. How do you know that you're successful? Just if you get them on a program like this, and again, I'll be happy to show you these books that I've got, but I think it takes about 90 days to make a change. Now, as you get older, it's going to take longer. But I definitely have seen these changes when you're looking at it, that the oral cavity will improve, and improve dramatically. Look in the mouth, the periodontal condition will improve. Look at the tongue. Is the bad breath still there? And also just look at that lifestyle assessment program. They bring in their book and they show us what they've been doing. You know, and it's a weekly process, and it works out very well. You've got to get the patients involved, or they won't do it. The handouts that I've given you, the tooth organ chart is on top. Then the acid alkaline food list. I think those are excellent handouts. The hydrate. All these are good handouts for your patients if you like them, or you can revamp them any way that you like. But put these things in your patient's hand. The very last one is a 2-minute dental evaluation. Give that to your healthcare providers, because they can help you tremendously. They just have to understand that there's something going on above the neck that we can work together with. This was my saying back in 2004. I said, the body is designed to heal itself and will remain healthy if given the opportunity. And that is it. We did okay. I do believe, I'll say one thing though, if you kind of agree with what we're talking about here, dentistry is in for a huge paradigm shift. Where's Vince? Vince from Chicago. There he is. Vince you're going to be in dental school next year? Applying. And he asked me, he says, do you have any advice? Well, you know, as I said too, I hate to say, sometimes you got to bite your tongue and be careful and go through the process, because I think so much that we've learned has been after dental school. But I really think that if we continue on this concept of nutrition and biological care, it's going to get into the dental schools as well, and we're going to just be able to offer a tremendous gift for our patients. So thank you very much.